Man gets PSA test result in patient portal, logs in expecting normal number around 4 or 5, sees PSA 547, immediately thinks, this must be lab error. Nobody has PSA that high, calls lab tech checks. Says, sir, we ran it twice. The result is accurate. You need to call your doctor immediately. Man still doesn't believe it. Feels fine. No symptoms. How can PSA be 547? Calls doctor. Doctor's office tells him, come in today. Don't wait. Doctor does examination. Orders immediate imaging. Bone scan, CT scan. Results show metastatic prostate cancer. Throughout skeleton. Lymph nodes. Extensive disease. PSA 547 wasn't lab error. It was accurate measurement of advanced cancer. He'd had no idea existed. Doctor explained, PSA levels correlate with cancer burden. Numbers this high almost always mean widespread disease. Most men think PSA of 5 or 6 is high. They panic. But PSA of 500 is different universe entirely. Study from Cancer Journal analyzed PSA levels and disease extent. PSA 5 to 10. If cancer present, usually localized. 75% confined to prostate, PSA 20-50. If cancer present, 40% have spread beyond prostate, PSA 100, 500. If cancer present, 90% have metastatic disease, PSA over 500, nearly 100% metastatic. Today, we're explaining what different PSA numbers actually mean. The context behind 5, 20, 50, 100, 500. Because understanding the numbers prevents panic at 5 and ensures urgency at 500. Your PSA number tells a story. Let's learn to read it. This is educational information, not medical advice. PSA interpretation requires medical evaluation. Never diagnose yourself based on numbers alone. Always consult your doctor. Comment numbers below for the free PSA interpretation guide explaining what your specific level means with context. Link is pinned. Now, let's start with the range most men experience first. PSA 4 to 10, the gray zone. PSA between 4 and 10 is called the gray zone. Most common range for initial concern. Study from New England Journal of Medicine. Among men with PSA 410 who undergo biopsy, only 25% actually have cancer. The other 75% have elevated PSA from benign causes. So PSA 6 doesn't mean cancer. It means 25% probability of cancer if everything else is average. But context changes that probability dramatically. Man with PSA 6, age 55, free PSA ratio 25%, PSA stable for 3 years, normal exam, his actual cancer risk about 10%. Same PSA 6, but age 65, free PSA ratio 8%, PSA risen from 3.5 1 year ago, nodule on exam, his cancer risk jumps to 55%. Identical PSA number, 5-fold difference in cancer probability. The key context factors in gray zone, free PSA ratio, percentage of PSA that's unbound. Lower is worse, free PSA under 10%. High cancer risk, 50% or more. Free PSA 10 to 25%. Moderate risk, 20-30%. Free PSA over 25%. Lower risk, under 15%. PSA velocity, rate of rise over time. Rising faster than 0.75 per year, concerning. Stable or slow rise, reassuring. PSA density, PSA divided by prostate volume. Over 0.15, concerning for cancer. Under 0.10, reassuring. Age, older men naturally have higher PSA. Age-specific normal ranges, 40s, 0 to 2.5, 50s, 0 to 3.5, 60s, 0 to 4.5, 70s, 0 to 6.5. Man age 72 with PSA 6 might be completely normal. Man age 52 with PSA 6 needs evaluation. Digital rectal exam, hard nodule concerning, smooth enlargement reassuring. Research from Journal of Urology, combining PSA with these factors predicts cancer far better than PSA alone. Gray zone means uncertainty, but context reduces uncertainty significantly. PSA 4 to 10 with good context. Monitor carefully, often avoid biopsy. PSA 4 to 10 with concerning context. Proceed to imaging and likely biopsy. The number alone doesn't decide. The complete picture decides. But what about higher numbers? Let's discuss PSA 10-20. PSA between 10 and 20 shifts probability significantly. Study from European Urology. Among men with PSA 10 to 20 undergoing biopsy, Approximately 50–60% have cancer. This is no longer gray zone. This is elevated concern zone. But even here, 40–50% don't have cancer. Still significant chance of benign cause. Common benign causes in this range: prostatitis, prostate infection or inflammation, can elevate PSA 10–50 points temporarily. Severe BPH, very large prostate, 100 plus grams, can produce PSA 10–20 even without cancer. Recent activities: ejaculation within 48 hours, vigorous cycling, prostate manipulation can temporarily spike PSA into this range. Man told me his story. PSA came back 18, terrified, scheduled biopsy. Then remembered, had sex night before blood draw, had cycled 40 miles day before, had digital rectal exam during physical that triggered PSA test, triple impact on PSA. Doctor said, let's repeat PSA in 1 month. Avoid sex, exercise, prostate manipulation for 48 hours before test. Repeat PSA 6.4, dropped from 18 to 6.4 just by proper timing. But if PSA 10–20 persists after ruling out temporary causes, action needed. Research from Prostate Journal: PSA persistently 10–20 warrants imaging, likely MRI, to look for suspicious lesions before deciding on biopsy. If MRI shows concerning area, targeted biopsy of that area. If MRI normal, may monitor closely with repeat PSA and imaging rather than immediate biopsy. PSA 10–20 is serious, but not automatic cancer diagnosis. Proper workup: rule out temporary causes, get imaging, consider biopsy based on complete picture. But numbers above 20 change the equation further. PSA between 20 and 100 indicates high probability of cancer. Study from Cancer Journal: among men with PSA 20–100, approximately 80–90% have prostate cancer on biopsy. If cancer present at these PSA levels, higher likelihood of higher Gleason grade, more aggressive cancer. Extraprostatic extension, cancer beyond prostate capsule, seminal vesicle invasion, cancer in nearby structures, lymph node involvement, 15–30% chance depending on other factors. At these levels, staging becomes critical. Not just, do you have cancer, but how far has it spread? Imaging needed: prostate MRI, CT scan of abdomen or pelvis, bone scan to check for metastases. Man with PSA 45 told me, doctor found cancer on biopsy. Gleason 8, but staging scans showed cancer still confined to prostate and immediate area. Surgery was successful, cancer-free 5 years later. Another man, PSA 38, cancer found, but bone scan showed metastases in spine and pelvis. Surgery not option. Hormone therapy and radiation became treatment plan. Same PSA range, 30s, 40s. Very different disease extent, very different treatments. PSA level alone doesn't tell whole story even in this range, but generally, PSA 20–50. If cancer, often locally advanced but potentially curable with aggressive treatment. PSA 50–100. If cancer, higher risk of metastatic disease. Cure still possible if staging shows localized disease, but less likely. Research from Journal of Clinical Oncology: men with PSA 20–100 and negative staging scans treated aggressively had 60–70% 10-year survival. Those with positive staging scans, 30–40% 10-year survival with combination therapy. High PSA in this range is serious, but outcomes depend on staging and treatment, not PSA alone. What about PSA over 100? That's where numbers tell clearer story. PSA over 100, especially over 200, almost certainly indicates metastatic prostate cancer. Study from European Urology: among men with PSA over 100, approximately 95% have cancer. Of those with cancer, 90% have metastatic disease. At PSA 500, like the man in our opening story, metastatic disease is virtually certain. Why such high numbers? PSA is produced by prostate cells, both normal and cancerous. When cancer spreads throughout body, tumor burden becomes massive. Millions or billions of cancer cells all producing PSA. PSA level roughly correlates with total cancer burden. Research from Cancer Journal analyzed PSA levels and disease extent. PSA 100-200. Average 3 to 10 bone metastases. PSA 200-500. Average 10-50 bone metastases. PSA 500 plus. Extensive skeletal involvement, often visceral metastases. Liver, lungs. The man with PSA 547 had over 50 bone metastases visible on scan. Cancer in spine, ribs, pelvis, femurs, skull. At these levels, treatment focus shifts from cure to control and quality of life. Hormone therapy to suppress testosterone, which fuels prostate cancer, can drop PSA dramatically and slow progression. Radiation for painful bone metastases. Chemotherapy for advanced disease. Newer targeted therapies. Man with PSA 547 started hormone therapy. Within 3 months, PSA dropped to 12, pain improved, quality of life better, but this is management, not cure. Average survival with PSA over 500 at diagnosis, 18-24 months even with treatment. Research from Journal of Clinical Oncology. 5-year survival for men presenting with PSA over 200 is approximately 15 to 20%. These are sobering numbers. But treatment does help. PSA over 500 without treatment. Median survival 6 to 12 months. With aggressive treatment, median survival 24-36 months, some men much longer. The critical lesson, PSA this high means disease was present for years. Likely started as PSA 4 to 10 years earlier. Regular screening and action on persistent elevation prevents reaching PSA 500. Now let me explain how to use PSA trends over time. Beyond single PSA number, trend over time is critical. PSA velocity, how fast PSA rising per year. Study from Journal of Urology. PSA velocity more predictive of aggressive cancer than single PSA value. PSA rising less than 0.75 per year. Generally reassuring even if absolute number elevated. PSA rising more than 0.75 per year. Concerning even if absolute number still in normal range. Example, man with PSA 3.0, then 4.2 1 year later, then 5.8 next year. Velocity, rising 1.2, 1.6 per year. Very concerning despite PSA still under 10. This pattern suggests aggressive cancer more than stable PSA of 8 would. PSA doubling time, how long PSA takes to double. Doubling time under 3 years, concerning. Doubling time 3 to 10 years, moderate concern. Doubling time over 10 years, less concerning. Research from Cancer Journal, men with PSA doubling time under 3 years had 85% probability of cancer with high Gleason grade. Men with doubling time over 10 years had only 25% cancer probability, and when present, usually low grade. The strategy, track PSA over time. Don't react to single number in isolation. Man told me, my PSA was 5.2, then 5.5, then 5.3, then 5.7 over 4 years. Numbers bounced around, but trend flat. Doctor said, velocity essentially 0. Not concerning. Continue monitoring. Another man, PSA 4.1, then 5.9, then 8.2 over 2 years. Doubling time less than 2 years. Doctor said, rapid rise, very concerning. Need immediate evaluation regardless of absolute number. First man, PSA reached 6 but velocity flat, benign prostatic enlargement. Second man, PSA only reached 8 but rapid velocity. Aggressive Gleason 8 cancer. Context of change over time matters enormously. Now let's discuss how age affects interpretation. PSA interpretation must account for age. Prostate naturally enlarges with age. More prostate tissue produces more PSA even without cancer. Study from Prostate Journal established age-specific PSA ranges. Age 40-49, normal 0.2.5. PSA over 3 needs evaluation. Age 50-59, normal 0.3.5. PSA over 4 needs evaluation. Age 60-69, normal 0.4.5. PSA over 5 needs evaluation. Age 70-79, normal 0.6.5. PSA over 7 needs evaluation. Age 80 plus, normal 0.7.5. Higher cutoffs due to high rate of benign enlargement. This means PSA 5 in a 45-year-old man, very concerning, well above age-appropriate range. PSA 5 in a 68-year-old man, mildly elevated but often benign given age. Research from European Urology. Using age-specific ranges reduced unnecessary biopsies by 30% in older men while maintaining cancer detection in younger men. Man age 76 with PSA 8 came to me worried. His doctor wasn't concerned. I explained. For your age, PSA 8 is common with benign prostatic enlargement. Your prostate exam showed large, smooth prostate. Free PSA 22%, PSA stable for 5 years. All reassuring despite numbers seeming high. Another man, age 48, PSA 3.8. His doctor was concerned despite number in normal range. Because for age 48, PSA 3.8 is elevated. Led to further testing. Found early cancer, cured with treatment. Age context prevents both unnecessary alarm in older men with age-appropriate PSA and missed cancers in younger men with seemingly normal PSA. The complete picture: PSA number, age, velocity, free PSA, exam, prostate size, family history. All factors together determine meaning and appropriate action. Let's return to core message. PSA number alone tells incomplete story. PSA 5 can mean nothing, can mean everything, depends on context. PSA 50, almost always serious. But staging determines if curable or manageable. PSA 500, virtually certain metastatic disease. But treatment still extends life significantly. The man with PSA 547 learned this lesson painfully. He'd had PSA tests years earlier. PSA 6, then 12, then 28 over 5 years. Each time he'd ignored it, felt fine, assumed benign. By time PSA reached 547, cancer was everywhere. He told me I thought PSA was just a number. High numbers happened to other people. I didn't understand what the rising trend meant. If I'd acted when PSA was 12 or even 28, cancer likely still localized, potentially curable. Now I'm managing incurable disease. His message to others: understand what your PSA means, not just the number, the trend, the context. The urgency different levels require. Research from Journal of Urology. Men who tracked PSA trends and acted on persistent elevation had 70% cure rate. Men who ignored rising PSA until symptoms appeared had 30% cure rate. Understanding numbers saves lives. Remember, comment numbers for your PSA interpretation guide. If this helped you understand PSA better, like and share with others confused by their numbers. Subscribe for next week's video on what to do when PSA is elevated. PSA 5, 20, 50, 500. Each tells different story. Learn to read your story. Early chapters allow rewrites. Later chapters are set. Your PSA, your understanding, your action, your outcome.